You're listening to the new media. You're listening to Mitchell Talks. Learn more at MitchellTalks.com and follow me, Scott Mitchell, on Twitter at Mitchell Talks. Welcome to a Mitchell Talks series, the proposed tobacco tax increase and why health advocates are pushing so hard. Our guest is Dr. Bob McCaffrey, physician and professor at the University of Oklahoma College of Medicine and Associate Director of Policy with the Oklahoma Tobacco Research Center. Would it make a huge difference?
It would be a huge difference, Scott. As I said, it's the number one preventable cause of premature death, but it also would help in terms of diseases in almost every area that you can think about. So we would see an almost immediate reduction in heart attacks. We do know that the individual's risk of a heart attack goes back to a non-smoker in about a year. We do know that there's a reduction in the risk in lung cancer. It never goes down to a never smoker, but the risk does decrease significantly the further you get away from having stopped smoking. And I should make this point also. There is never an age at which you should not stop smoking. Some people say, well, gosh, I'm 60. What good will it do now? We have good data that if you stop at, even if you're a lifelong smoker, if you stop at 60, you add significant years to your life expectancy. If you stop at 70, you add significant years. Now, obviously, the earlier you stop, the better your outcomes, your risk becomes. But it doesn't really matter if you already have disease. It helps if you stop smoking. So we would see not only an immediate improvement in our health status, but that improvement would continue and increase over the years and decades.
Earlier you said you think this is a moral issue. And out at 23rd and Lincoln, not too far from here, there are folks that are grappling with a $1 billion budget hole. And there are some folks who have a lot of interest in mind. They've got, can I get reelected? Am I going to help people? Am I going to hurt people? That sort of thing. Put yourself, take your what you know, put yourself in the place of one of these legislators who's trying to work with their party, work with their caucus, do all of these things that need to be done, and talk to them about why this, from your vantage point, this would be really important, regardless of the politics and regardless of the fact it wouldn't fill the budget hole. We're hearing that quite a bit. But give a coach talk to legislators from your vantage point about why they should vote for this and move it on down the road.
Sure. Well, this is really a win-win-win all the way around. First of all, I do think it's a moral issue. When we have something we can prevent that's killing our children, why don't we prevent it? We can prevent it. And if we don't prevent it, we are simply committing our kids to lives of illness and premature death. So that's number one. But, okay, on the income side, it'll bring in the first 12 months, we estimate that it'll bring in about $184 million. I know that those estimates vary, but we're pretty confident of our numbers. Now, the first year, well, I won't get into the details of that, but it will also reduce, first of all, our Medicaid expenditures in the state. Right now, our Medicaid expenditures are someplace in the range of, $260 million, I think, something in that range. So that will certainly reduce our Medicaid expenditures fairly quickly, actually. Now, that reduction will increase over the years as people see the benefits, the continued benefits of not smoking. So you have increased income, reduced expenses, but more importantly, we're adding to the productive years of the people who quit. Now, if you talk about economic development, companies, people talk about taxes. Well, I'm not an expert in economic development, but what I'm told by the people who are is that if you ask companies the most important things they look at when they're looking at moving company, taxes are on the list, but way down the list. What they're looking at is lifestyle. They're looking at having a healthy working population. They're looking at having an educated working population. So education and health are probably, in my view, the two most important things we can do for economic development in the state. So you would have even further increased taxes as we get good quality jobs coming into the state, which they will if we have a good education system and if we have a good healthcare system. And businesses lose about $156 million a year because of time off work due to tobacco-related illnesses. There's good data from California, for example, and I know that people don't like to hear about California, but some of our best research comes from there, that when bars went non-smoking in California, the medical care cost for time off and the time off work for the bar workers went down significantly. Now that relates to secondhand smoke, which we've not really talked about very much, but secondhand smoke is a huge problem. But the economic cost of smoking specifically is a huge anchor, if you will, on economic development and on recruiting new companies here.
Business leaders tell you they support the idea of a
Yes.
cigarette tax increase?
Yes, the state chamber is very much in favor of the tax increase. I believe that that's true of the Oklahoma City Chamber as well. So the business leaders are cognizant of the cost of smoking on their businesses.
You're listening to the new media, the Mitchell Talks Network. Learn more at MitchellTalks.com and follow me, Scott Mitchell, on Twitter @MitchellTalks.